Hello world, welcome to our podcast on marijuana. My name is Dr. Kundlas and I'm a primary care physician for last 25 years. My goal in this podcast is to make you aware about what marijuana is, what are the receptors, how it works in the body, what are the medical uses of marijuana, what are the pitfalls, and what we could do about it, and what are the implications of the marijuana legalization and the moral authority or authorization which we are providing to our young adults. Marijuana is not a new drug. In ancient India and Chinese culture, it has been used for almost 5,000 years. I am from India and marijuana grows wild in India. And very rarely growing up, I've seen anybody using or abusing it, especially on certain festivals, which are dedicated only in certain parts of the religious practices where marijuana is used. But most of the time, nobody uses or abuses marijuana. In the United States, it was made illegal in 1930s, and in 2000s, marijuana has made back into our mainstream, and with legalization in 1996 in California and then multiple other states following the suit, it has been approved. Like any other drug, marijuana has definite uses, and in certain resistance cases it has produced dramatic results, especially in some neuropathic pains, multiple sclerosis treatment, resistant seizures. It has definitely changed the landscape. If we use it or if we consider it as a pharmacological agent, I truly believe we should not limit or restrict use of marijuana for medical use. But we will explore what shape it is taking. The statistics are really very discouraging. In 2024, 18% of United States population accepts regular use of marijuana, and out of them, about 9% meet legal definition of cannabis use disorder, meaning they're addictive to that and they depend on that, and if they don't procure it, they will be in trouble. Young adults are the segment of population who are using it the most. Of young adults between the age of 19 and 30 have confirmed that they have used marijuana in the past year, and about 19% confirm that they're using on a daily basis. Younger age group adults are at the higher risk for complication. Most scary ones are and dementia. So this is not a panacea. This is definitely a very difficult drug to handle. More stringently and properly the way it's being done. When the states are approving marijuana, the scope of use is unlimited. Technically, you could use it for anything and everything. And there is a big industry which is built around it. About $45 billion of revenue is at stake in the marijuana industry. Marijuana plant is basically of three kinds: marijuana sativa, indica, and hybrid. And they all differ into two chemicals which are available in cannabis. One is THC, other is CBD. There are two other chemicals which are also therapeutically being tested and used, but chemically this plant has almost 400 different kind of chemicals which may affect body one way or the other. We know they exist, but none of them have been studied. How this THC and CBD and other chemicals in cannabis act on your body. Whenever a drug enters into your system, where it has to get attached and make certain changes in the cells so that you get the desired effect. Endocannabinoid system is vastly available in your body. Central nervous system, which includes your brain and spinal cord, is very rich in CB1 receptors. Your immune cell, your liver, your spleen, your kidney, your gut is very high concentration of CBD or CB2 receptors. CB1 receptors in the brain modulate and affect every part of your brain. The major areas is your prefrontal cortex, which is your executive center, which makes us human. Your critical thinking, your ability to analyze, your ability to do something and not do something depends on your prefrontal cortex. CB1 receptors are present in amygdala. They are present in hippocampus. They are present in the basal ganglia, cerebellum, spinal cord, affecting your perceptions, muscular function, your memory and emotions. In your peripheral system or in your body, the CB2 receptors primarily modulate inflammation. So they can affect every part of the inflammation cascade. If they are overexcited, it has consequences. If they are underexcited, it has consequences. The response of our body to inflammation has to be appropriate. Once we discuss the pharmacological effect of cannabis and the side effects of cannabis, we will discuss this thing in detail. Let's take organ systems. Lungs. Cannabis leads to, or chronic use of cannabis lead to inflammation in your alveoli. It can give you chronic bronchitis. It can give you chronic pneumonias. That can affect in your breathing. And it is a lot more pronounced in children or young adults who are using vaping. Because when they are chemicals which they are adding in these vapes, they also add to the chemical injury to your lungs. In your brain, it affects your cognitive function, which I have just now alluded, your ability to think, understand, and make useful decisions. Emotionally, marijuana goes both ways. It can calm you down and you feel relaxed, but it can make you hyper anxious, paranoid. If you have family history or you have personal history of any psych disorder, the negative symptoms will predominate. It affects your kidneys, it affects your heart, it affects your liver. There is not an organ system which is not getting affected. And there is a difference between acute use and chronic use. Acute use is you are new to cannabis. When you are new to cannabis, the body reacts differently. And if you are constantly using cannabis, your body reacts differently. By and large, our autonomic nervous system has two arms, sympathetic arm and parasympathetic arm. Sympathetic is your fight and flight. Parasympathetic is rest and digest. Marijuana differentially stimulates the parasympathetic, differentially stimulates the sympathetic arm of the system, autonomic nervous system, and it suppresses the parasympathetic system. So basically what you have, you're pushing a gas pedal and you're taking the brakes off. So you are going at a super fast speed without brake. And we all know when our brakes don't work, what happens. In chronic use, so initially when you are new to marijuana, you get excitation, euphoria, everything which marijuana is known for. But with the chronic use, your sympathetic system is continuously being stimulated and parasympathetic system, which is the brakes, they are taken offline. Then you start developing hypotension, tachycardia, you feel palpitation, you drop your blood pressure, you start falling. This is a very significant shift So you have to look at it. Marijuana use, are you new to marijuana? You're going to have a different symptoms. And if you're chronic, you will have different symptoms. It affects almost all the neurotransmitters in the brain. Initially, it can improve norepinephrine, which is the neurotransmitter for arousal and alertness which you get. Then it can stimulate dopamine, which gives you sense of reward, relaxation, motivated. It affects serotonin, that is your mood regulator. It affects acetylcholine, which can improve initially your memory. It can increase the function of GABA receptors, which is the inhibitory part, and you modulate your pain. It suppresses the glutamate, that's why your perception gets distorted. So you see, it affects almost all the chemistry of your brain, and it changes it forever. So you need to understand there is a difference between acute use and your chronic use. As we go along, when we continue to use it on chronic basis, we have to use more and more as body become dependent on it, and it leads to more and more complications. It is well known and accepted. Anybody above the age of 80 and anybody less than the age of 25 should not use marijuana at all, because it affects your body a lot more adversely on this extreme ages of life. It is very addictive and it will lead to multiple complications. As I just now alluded, there is not an organ system which is not affected. Then, under the effect of marijuana, your judgment is impaired and you make wrong decisions. We conduct survey in our office and we ask all the questions about a given topic, and we try to answer those questions in this podcast. The first question was, should medical marijuana be legal? Why and why not? I think this is a very intelligent question. Marijuana, as I stated in the beginning, in certain cases, it could be lifesaver and it could be very useful. But those cases are very extreme in a few cases. My problem with marijuana, or my experience, is dictating that it is being touted as a panacea, harmless drug, which is not the case. It is leading to lung problem, increased risk of heart attack and stroke, liver problem, kidney problems, loss of memory, infertility. It is not an innocuous drug. And as more and more use is happening, we are seeing more and more complications. I truly believe it should be legalized and it should be regulated more than the way it's being done. I'm seeing one very common pattern that patients have marijuana legal card and they are using it as a legal cover and they're still buying on street. I may be criticized for these comments, but that's what I see every day on daily basis. Second question was, what are the health benefits of marijuana? If used properly, marijuana can help with anxiety disorder, depression, multiple sclerosis, seizures, chronic pain, both musculoskeletal and neuropathic pain, and also to stimulate your appetite and nausea in chemotherapy. But this is no different than any other drug, which should be used for right reason with the right dose. The commercially available preparation which we get from street, they are unregulated. The amount of THC and CBD is very high and it should be regulated. Question 3, what are the risk factors or what are the risks of long-term marijuana use? I think we covered it, but I would like to repeat it again. We in medicine take approach from head to toe. We'll start with the brain. Brain does very important functions. Let's take cognitive functions. Cognitive functions are the one, our ability to understand information, interpret it, and act on it. Chronic use of marijuana interferes with all these domains, and we make wrong decisions, and we are not able to impulse control. Second, our radar system, which is amygdala, marijuana potentiates its action and leads to more anxiety in the long run. Memory. Hippocampus has high concentration of CB1 receptors. Chronic use leads to memory loss, and is especially very predominant if you start using marijuana at a younger age. That's why nobody should use marijuana below the age of 25. But unfortunately, the statistics are very disturbing. It affects your heart. You have increased risk of heart attack and stroke. It has increased risk of arrhythmias. In lungs, you have increased risk of chronic bronchitis and alveolar dysfunction and pneumonias. It can lead to liver dysfunction. It can alter the sense of perception of pain and your environment. Next question. How does marijuana affect the brain? I think I have answered this question in detail just a minute ago. It affects all your domains, both cognitive, emotional, and spiritual and physical domain. This is not an aqueous drug. Can marijuana help with chronic pain? Absolutely. That's one of the indications where marijuana excels. But it needs to be used properly. In my experience, I have not come across any patient who has been getting some kind of other treatment for chronic pain and have started using marijuana and have stopped using other controlled medications. People are using marijuana as an adjunct therapy, not a replacement for the other controlled medications. And that is a very sad proposition. Now we are doubling up the controlled medications, and it has effects and implications in long run. How does marijuana use affect young adults? I think that's a topic in itself. Younger you start using it, more complications you will have. In your younger years, you will have difficulty with your sexual health. It is well known, sperm count decreases, the sperms are deformed, and testosterone level goes down, your libido goes down, you have difficulty in erections, and it will have difficulty in relationships. Further, as you go through circle of life, you will have all the side effects of chronic use, which I have answered in the last question. But in the end, you will start losing memory and you will have dementia at an early age. Young adults should not use marijuana. What are the differences between CBD and THC? There are two kinds of receptors in the brain, CB1 receptor and CB2 receptors. CB1 receptors are primarily in the brain and spinal cord. THC acts on CB1 receptors and produces that euphoric symptoms. That's why it has psychoactive properties. CBD acts on CB2 receptors primarily. It helps to modulate pain. You could say, take the euphoric effect out of marijuana. CBD does exactly what you want to do. CBD, that's why you will find a lot of preparations of CBD oil, CBD tablets, and different tinctures, and multiple ways the CBD is being sold. CBD does not have any euphoric symptoms. Next question which comes over and over is marijuana addictive? Absolutely, marijuana is addictive, and marijuana or cannabis use disorder is a well-known entity. Please refer to our one-off videos which we have already posted to get the answer to this question. How does marijuana use impact mental health? It's a two-way street. In certain situations, marijuana can relieve anxiety, help with depression, but in certain population, it can make you extremely nervous and paranoid, and they can go another way. Even the experts in this field cannot predict based on patient profile which patient will have positive symptoms or negative symptoms. Next question is, can marijuana lead to respiratory problems? Absolutely. It is shown to increase chronic bronchitis and risk for pneumonias. How does marijuana interact with other medications? Marijuana is notoriously known to prolong and potentiate the effects of anesthetic agents and muscle relaxants. If you are going through a surgery, you must let your physician know so that they could adjust your medications. I've seen many people getting into trouble because either they failed or they do not want to give marijuana history in spite of being asked. This is not a simple matter. It is serious. If you are using marijuana and you're going through any kind of surgery, you must let us know, or you must let your primary care physician know. What are the impacts of marijuana on cardiovascular health? Marijuana increases the risk of heart attack and stroke. Use for right reason and with caution. Next question is, how can marijuana be used safely? Only paradigm is use marijuana for right reason, and you should get proper legal prescription, and you should use for right reason under the guidance of your marijuana doctor. Do not use it without proper indication. I hope I have answered a lot of your questions. I'm reviewing my list if I could help you to answer any question which I might not have covered. In a nutshell, currently the proper use of marijuana which is approved is for chronic pain, persistent nausea and vomiting, for appetite stimulation, for anxiety, multiple sclerosis, Parkinson's disease, Tourette disease, and migraine. It is a wonderful drug if used properly. If we are going to regard this medication as harmless and panacea, I think we're going to pay the price. My fear is what I see in the practice. This medication, people are not taking it seriously and they are just using it as a herb. I do not see any decrease in use of controlled medication in individuals who are using marijuana. There are very few patients occasionally which I get who really had some resistance symptoms who have benefited from ongoing marijuana use. Let's all be responsible, use it for right reason, in proper concentration and dose. And I will see you in the next podcast. My name is Dr. Kundlas. I'm signing off in this video. Thank you very much.